back to another perspective. From this one, we're actually going to take a question out of the mailbag, so to speak, from one of our members. So, this is one of the reasons we want to encourage membership is, sort of asking, the pros here about, things that you have on your mind from a practitioner standpoint, an athlete, a parent. Today's question comes from another fellow optometrist who asks us questions about fees. How do we charge for sport vision testing? How do we charge for examinations and things like that? I think this is a great question because the three of us work in very different environments, from a collegiate environment to an ophthalmology practice to an optometry practice, and I think we all handle it a little differently. So I'm going to kick it off by basically saying that there's not a perfect way to do this, and there's not one way to do this, but there are many different models. And I'll let Frazier start with sort of some of his models, go to Derek, and then we'll kind of wrap back up. So Frazier, what do you think about that?
Yeah, I mean, we talk within our sports vision elective when we're talking with our students about there are different ways to structure your fees and to work with these with the teams. We have one professional team that we work with that we bill insurance because part of that the whole league has vision insurance, so we work through that when it comes to their comprehensive vision exams. One of the other things we are often faced with as well when we work with the university are the NCAA regulations. So what we may do for a professional team, I can't do with our collegiate athletes because of NCAA regulations. So we have to be aware of that while we're working with them. But ultimately, we try to structure it so that way whatever works best for the team and is mutually beneficial to where we can help them is the way we go. So Derek, how about you? What different ways do you know of helping with some of the teams?
Well, I think one of the things to keep clear, from all patient standpoint and, our doctors out there is that, the gateway is going to be your medical exam initially to assess the patient's health. I think that's the first thing that everyone's going to do to clear that up, make sure the patient has no overriding medical vision issues. And then I think from there, what both doctors and patients have to understand is this is really going to come down to the amount of time that the physician is going to be dedicating to this. And that's how they're going to charge based on the time that's involved. Now, sometimes this is done as a package or sometimes this is done as an hourly rate. Initially, what I found is most of the time, the fee's a little bit higher at the beginning of training, a lot more doctor-patient interaction time. And as I can get the athlete kind of more independent and working a little bit more on their own or maybe with staff, then things get a little bit different, as well. Keith, you can do anything like that?
Yeah, and I think that's a great way to put it too, Derek. I mean, the time is certainly a huge factor. I think another huge factor is some of the technology and the fact that, this technology is emerging very quickly. We have a lot of companies making technology out there that's not insurance covered, so to speak. So, from my personal perspective in my individual primary care optometry practice, we sort of open the door to the fact that, certain things that the athletes are coming in for will be covered through their medical insurance. If it is a medically covered portion of the exam, we can certainly also use vision insurance if someone's buying glasses and contact lenses as a part of their sports vision plan. And if we're doing something maybe more sports performance based or maybe post concussion based or something that's really an evaluation or a performance enhanced training method, then those are certain things that may not be covered. So I think there isn't a perfect way to do it, and I think giving options to the patients where they can maybe sort of pick and choose what they're really here for in our practice sort of works well. And I think from a testing standpoint, it's also a very different thing for me personally with working with multiple different professional sports teams, is that they're all going to want a little something different depending on the season, depending on the trainer a lot of times, or the way that the coach wants it done to be least disruptive to the practice session. So sometimes it's let's come to us, let's go to the stadium, let's go to the arena, let's do an evaluation there. Sometimes it's coming into the office, but I think the big thing from a practitioner standpoint is try to stick to your guns, try to make it as comprehensive as you can. And if it really can't be done on site, make sure that you're at least opening the door to getting these athletes into your office to really be evaluated, because I think there's certainly something that the three of us would all say makes a comprehensive eye exam. And it's certainly not getting a quick screening at a pediatrician's office or looking at a stationary chart on the wall in a trainer's office. But I think there's a lot more to vision that we believe can enhance vision, that we believe can potentially protect athletes from injury, that really involves a lot more than just basic vision testing that a lot of people are familiar with. So I think that's going to be obviously a topic of another day, is what is a comprehensive sport vision evaluation, but the charges have to reflect that as well. Those are a lot of great ideas. Again, as we said, no perfect way to do this, but thank you for the question from our member. Please forward them, keep sending them. We'd love to know what you want to know about. We can sit here and babble all day long, but give us some direction, wind us up, and let us go. So have a good day, guys. Until next time.